Guys, welcome back to another session of Know Your Bones. If you're somebody who has low backache or you're somebody who wants to know about low backache, you have come to the right place now. I'm Dr Santhosh Jacob, an orthopedic surgeon from the city of Chennai, Tamil Nadu, India. And today we are going to talk about low backache and what else low backache could be. Could low backache only come from the spine, or could it come from any other bone or any joint which is lying close to the spine? That is what we will be seeing in this session. Today the story I'm going to share is of a 26-year-old lady patient of mine. Now this was a patient who was being treated by me for low backache for the past 7 years. She used to have low backache on and off, but she used to rest and the pain used to disappear. Whenever it used to come back, which was 3 to 4 times a year, she used to take painkillers, do physiotherapy and rest, and then start off as if nothing had happened. She had gotten used to living with the pain, and then something peculiar happened 4 months ago. She had one severe episode of pain where she was just not able to move, and the pain was also radiating to the buttocks and to the back of the leg. She had also developed an episode of fever and her low back was feeling warm, she said. So they brought her to me in an ambulance. She was unable to walk. It was that severe. So I spoke to her and I told her clearly that even though her x-rays seemed more or less normal at this point of time, an MRI would be a very good idea. But I also told her that as the pain is radiating, she might have a problem in the spine like a disc bulge, but an MRI will show us clearly if there is any other joint involved. Because of the fever and the warmth in that region, I suspected that it could be an inflammation of a joint which is just below the L5 region, which is known as the sacroiliac joint. Now, the sacroiliac joint is a joint which is between the sacrum, which is a triangular bone, and the ilium. What is this guy talking about? Please don't worry, I thought about it. And I have a surprise for you. So now if you see, this is your pelvis. This is your pelvis from the front. And as I move down, you can see the sacroiliac joint at the front. The triangular bone I spoke about is the sacral bone, and that is the sacroiliac joint. Now, when I turn the bone at the back, you can see that the sacroiliac joint, you can see the sacroiliac joint here. Yeah. Now, this sacroiliac joint connects with the L5 at this point, this close it is. So from the back, if you see, this is the sacroiliac joint and your L5 comes at this region, and this is your lower back. Now can you see why it would be so confusing for anybody to describe the pain or to diagnose the pain without a scan? Because an X-ray does not show early inflammatory changes or just inflammatory changes at all. That is why sometimes a more advanced investigation like an MRI helps us clear the diagnosis. The MRI scan results of the patient came and her spine was completely normal. She had an inflammation of the sacroiliac joints. Now, inflammation of the sacroiliac joints is known as sacroiliitis, and it is a very common cause of low back pain in young adults. So sacroiliitis is basically inflammation of the sacroiliac joints. Pain could be just in the sacroiliac joints at the back, or sometimes even at the L5-S1 junction. You guys have heard the L5-S1 mentioned many times in the doctor's office. So S1 stands for the first bone of the sacrum. So L5 comes on top, then there is a disc here, and then comes S1. So an L5-S1 disc bulge signifies a disc bulge at this junction. One of the reasons why I wanted to discuss sacroiliitis, it is one of the most commonly misdiagnosed reasons of low back pain in young adults. Reason why I am making this video is, if you know what to tell your doctor, it will be easy for your doctor to diagnose right. And when we diagnose right, most of the time the treatment is very simple. And when we diagnose early, most of the time it is non-surgical. So this is why you need to learn about your symptoms to make yourself a harder target once again.